you ready?
Yes, I'm ready. I started to use the Flex membrane 4 years ago. The main indication for the Flex membrane in my case is when I'm doing horizontal GBR. Another indication is when I'm doing surgical procedures with orthodontic bows, for example, when I'm combining corticotomies with GBR. In those cases, I use the Flex. I applied wet. I avec the membrane with blood from the own patient like 3-4 minutes before I applied it to the mouth. It has an amazing elasticity and an incredible strength, so you can tighten the membrane, you can overload it, pin it, suture it without breaking it. Another important factor is the barrier function. So we can obtain all those advantages without compromising the soft tissue biocompatibility. So that's why I am using the Flex membrane for horizontal GBR, because it meets biological, clinical, and mechanical requirements.